Good day. May we present to you our synthesis paper entitled Human Immunodeficiency Virus, Unmasking the Chameleon, Terminating the Stigma. Let us go through first with the rationale of the cover photo. The chameleon represents the virus with its ability to transcribe RNA to DNA, which masks and enters the body unknowingly, striking the immunity of oneself. The red ribbon that unmasks the chameleon stands for the universal symbol on support and solidarity of people living with HIV. The red color and Manser-like virus pertains the level of basic knowledge of society about HIV, which signifies stigma and discrimination. The unmasking, which shows by unzipping the chameleon, illustrates the eagerness to put an end to the misconceptions, stigma, and discrimination, along with the advocacy to raise awareness and let people understand that they should not be afraid to the people infected, but on the virus itself. Together, let us unmask the chameleon and terminate the stigma. Let's proceed to the reasons for conducting the study. Human immunodeficiency virus is one of the most studied viruses due to the growing numbers of individuals acquiring the infection, despite massive and collaborative efforts put by the scientists, world and community leaders, and educators to study the nature of the virus, quest for treatment, and even cure. According to Joint United Nations Program on HIV or AIDS, there were 690,000 HIV-related deaths recorded in 2019, which sums up to 32.7 million deaths worldwide. In the same year, 1.7 million new cases were reported, which tally a total of 38 million cases of people living with HIV in the global scale. Meanwhile, HIV or AIDS and ART Registry of the Philippines reported the total figure of 4,787 death toll in the country since January 1984 to March 2021. Statistics also confirm that 31 new cases were reported daily, leading the country as the fastest growing epidemic in the Asia-Pacific region. This statistical finding alone speaks volume that cries for a strong state action. Thus, we, the researchers, aims to join the crusade in increasing public awareness by unmasking the hiding truths about HIV and debunking misconceptions to educate the people and terminate the stigma. The researchers also believe that with the right and sufficient knowledge, mankind will champ the battle against HIV. Let's proceed to the objectives of research synthesis. This research study aimed to bolster the public awareness about the uncharted truths about HIV. Specifically, this study was carried out to answer the following questions. First, what are the viral characteristics of HIV? Second, what are the modes of transmission of HIV? Third, what are the misconceptions about HIV transmission? Fourth, what preventive measures should be observed to avoid contracting HIV? Fifth, what are the immunological, hematological, hemostatic, and biochemical findings seen in HIV patients? Lastly, what are the treatments available for HIV patients? Let's proceed to the research design. This study utilized explanatory research design to investigate and study the hidden truths about HIV to come up with an informational material that provides correct information in a manner that is easy to understand. Next slide, please. For data gathering procedures in its validity, the data gathering procedures undergo 6 steps, and these were presented in the figure shown on the screen. For step 1, formulation of the research strategy. This is to have definite direction in data processing and overall planning on data gathering, analysis, and interpretation. For step 2, distribution of individual research tasks. This is to ensure collaborative effort between and among members of the group. Step 3, collection of data through databases such as book PDFs and online sources using search strings encompassing the terms associated to human immunodeficiency virus, also video documentaries related to the topic. Step 4, extraction and validation of data, wherein the researchers collated and summarized relevant data using inclusion criteria. A total of 185 resources were browsed, but after a thorough filtration and a validation, only 62 references met the criteria. Step 5, classification and organization of data. This is based on relevance and coherence of information for smooth shifting of ideas. Lastly, a thorough analysis and interpretation of data were carried out to come up with this research synthesis. For validity of data collected, the following were applied in the study. published literatures in 2016 up to present, books recommended by Commission on Higher Education and Philippine Association of Schools of Medical Technology, information filtered by website checker and published works of authors in the field of epidemiology, statistical data from research organizations and government agencies, and video interviews from medical experts. Next presenter, please.
At this time, let us start to unmask the chameleon-like monster, HIV, starting with its viral characteristics. As described by Mahon 2019 and Dormus and Ulgen 2017, human immunodeficiency virus is a retrovirus and is the etiologic agent of acquired immunodeficiency syndrome or AIDS. It is a non-icosahedral envelope virus that has 2 copies of positive single-stranded RNA genome. According to Terjon 2018, HIV infectious cycle starts when the viral surface glycoproteins bind to the receptors on the CD4 lymphocytes. After that, the viral contents are released into the cell where the RNA genome is reverse transcribed into DNA via the enzyme reverse transcriptase. The DNA will be transported to the cell's nucleus and will be integrated into the host cell DNA as a provirus. The HIV provirus will produce proteins and enzymes to form new viral particles that will be released from the cell to infect other cells throughout the body. As explained by Mahon 2019, the viral genome encodes structural, regulatory, and accessory proteins. The structural proteins are necessary for viral replication because they are associated with viral core, polymerase, and viral envelope. Next is the transmission of HIV. For us to be educated about how this chameleon-like monster enters our body, let me deliberate to you the ways how HIV transmits from one person to another. Salvania 2019 stated that unprotected sex is still the leading cause of HIV transmission. Flashed on the screen are the estimated per act probability of acquiring HIV from an infected source by exposure act. It is clearly shown that the receptive partner in anal sex is the riskiest sexual act with 138 risks per 10,000 exposures. As is stated by CDC 2021, HIV can also be transmitted via parenteral route. It occurs mainly through sharing of contaminated needles, syringes, or other drug injection equipment with someone who has HIV. According to Stevens and Miller 2017 and Turgeon 2018, healthcare practitioners like medical technologists can acquire the virus by an injury with contaminated needles, stick, or sharp objects like lancets and broken glasswares. CDC 2021 deemed that mother-to-child transmission is another way to pass HIV and is also the most common way that the children acquire HIV. McPherson and Pincus 2017 explained that the transmission probability is 13 to 45% depending on the maternal HIV-1 viral load. HIV is also transmissible postpartum in leukocytes in breast milk. According to CDC 2021, HIV can also be transmitted through blood transfusion or organ transplantation but is rare. This is because the donated blood, organs, and tissues are not thoroughly screened and tested. Greer et al. 2019 stressed that the current estimated risk of HIV transmission through blood transfusion is approximately 1 is to 1,467,000. Other uncommon modes of transmission include transmission through biting or deep open mouth kissing, pre-chewed food, sharing of contaminated razors and toothbrushes, and even manicure and pedicure tools. Next are the misconceptions about HIV transmission. Statistics prove that HIV spans the world, so as the misconceptions about its transmission. Here in the succeeding slides, we will provide the truths to the widespread misbeliefs about HIV transmission. Many people think that HIV can be transmitted through mutual masturbation, fingering, handjob, and through ordinary day-to-day contact. But the CDC 2021 Interjon 2016 cleared that HIV can only be transmitted when body fluid containing virus comes in contact with the mucous membrane or wounded tissue, or when it is directly injected into the bloodstream. Another misbelief is that HIV can be passed through sweat, tears, urine, or feces. This was denied by the CDC 2021 and Terjon 2016. HIV can be transmitted only through blood, pre-seminal and seminal fluid, vaginal fluid, CSF, serous fluid, amniotic fluid, and other blood-containing fluids. People also think that sharing personal objects, food, water, eating utensils, and even exercise equipment can transmit HIV. This was disproved by WebMD 2021. Water, uncontaminated food, eating utensils, and exercise equipment cannot transmit the virus. In addition, 3rd John 2020 said that only those things that were contaminated with blood can transmit the virus. Other misconceptions about HIV transmission is the passing of HIV through toilet seats, through bite of mosquitoes and ticks, and through airborne transmission. These were all disproved by WebMD 2021 and avert.org 2021. Furthermore, the National Institute of Allergy and Infectious Disease 2020 said that HIV can still be transmitted from HIV-infected person with undetectable viral load. For prevention, let us talk about the preventive measures on how to stop the transmission of HIV. Despite the concerted international efforts exerted by the world in resolving this HIV puzzle, there is still no vaccine and cure that are proven to be effective. This in turn emphasizes the need for practicing extreme caution and protecting oneself from this incurable disease. To avoid HIV transmission through sex, an individual must use a condom. As explained by National Institute of Allergy and Infectious Disease 2018, proper and consistent use of condoms demonstrates decreased risk of HIV transmission by 85%. According to CDC 2021, another way to avoid transmission of HIV while having sex is the uptake of antiretroviral drugs for pre-exposure prophylaxis and post-exposure prophylaxis. When taken as prescribed, pre-exposure prophylaxis decreases the danger of acquiring HIV by 99% in sexual transmission and 74% in parenteral transmission. To prevent mother-to-child HIV transmission, pregnant women who are HIV positive should get HIV care as this lowers the risk of HIV transmission to her baby. As HIV can be transmitted in parenteral route, it is advisable to restrain from sharing of injection supplies. HIV can also be transmitted through blood transfusion. The Section 26 of RA 11166 or the Philippine HIV and AIDS Policy Act mandated that all donated blood units must undergo HIV testing as part of screening panel. Donors whose blood, organ, or tissues that has tested positive are deferred from donation. Lastly, 3rd John 2020 said that HIV transmission can also be prevented by avoidance of sharing personal things like razors, toothbrushes, and manicure and pedicure tools that could be contaminated with blood. Next presenter, please.
Let us now proceed to the laboratory findings of HIV-infected individuals. First is in terms of immunological standpoint. According to Stevenson Miller 2017, the decrease of CD4 T cell is the hallmark feature of HIV infection, as it is the primary target of the virus. Tila 2019 illustrated that the sudden rise of P24 antigen is present in the month of 6 to 12 after exposure, and is considered to be the period of acute infection. Thus, the sudden decrease of anti-P24 antibody is considered to be a grave prognostic sign of HIV-1 infected patients. In the course of infection, the CD4 and T cell count slowly decreases, and anti-HIV-1 antibody eventually decreases as the infection progresses to AIDS. Profound immunosuppression, resurgence of viremia, life-threatening infections, and malignancies develops in this stage. Dysregulated immune response is evident in HIV infection, hence the occurrence of functional defects with increased circulating immunoglobulin levels, immune complexes, and autoantibodies. Next is in terms of hematological standpoint. Anemia was the most frequent observed cytopenia in HIV-1 infection. HIV affects RBC production due to interference of cytokines to hematopoiesis. Highly active antiretroviral therapies, medications used in HIV-related infections, low erythropoietin, and HIV-associated hypogonadism. HIV infection may also leads to thrombocytopenia. The inability of megakaryocytopoiesis to produce platelets causes defects which contributes to thrombocytopenia with patients with advanced disease. Maltodropenia is fairly common in HIV infection, which increases the frequency of significant bacterial infections. Lymphopenia is also a noticeable condition with increased CD4 and CD8 cell death and impairment function. Antiretroviral drugs used for treatment causes toxicities to hematologic findings of HIV patients with anemia. Some of these medications are zidovudine and stavudine that causes neutropenia and anemia, and glanciclovir that causes leukopenia and thrombocytopenia. In the bone marrow examination of HIV patients, morphologic abnormalities were demonstrated. Next is in terms of hemostatic standpoint. According to Greer et al. 2019, thrombocytopenia was found to be 2 to 10 times more common in HIV-infected individuals. In as many as 27 to 73% patients have elevated complement binding protein 4, which attaches to protein S and makes the protein inactive. Thus, the risk of thrombosis in these patients is substantially increased. And lastly, for biochemical standpoint, metabolic and biochemical changes were observed in patients with HIV due to abnormalities in blood lipids. According to Shujing et al. 2019, this lipidemia is highly prevalent among HIV-infected individuals. The laboratory findings presents decreased high-density lipoprotein and increased low-density lipoprotein and total cholesterol. And electrolytes and acid-base disturbances may also develop in HIV infection, such as hyponatremia and hypokalemia, which are markers of severity of HIV disease as explained by Damore and Hunta 2018. And according to Shivaji et al. 2018, HIV patients with kidney disease presents increased levels of protein, creatinine content, and abnormal value of glomerular filtrate rate. However, in HIV patients with liver disease, the laboratory findings presents decreased serum albumin levels and increased serum globin levels. Next presenter, please.
Now let's proceed in laboratory methods. Enzyme-linked immunosorbent assay or ELISA is the gold standard for HIV screening procedure since it is 99.9% accurate when combined with a confirmatory test. Fourth generation is the most current generation of ELISA according to Stevens and Miller 2017. In rapid tests for HIV antibodies, it provides results in about 30 minutes. According to North Dakota Department of Health 2020, a reactive test result is indicated by two lines, one in the test area and one in the control area. While one line in the control area with no line in the test area indicates a non-reactive test results. If there is no distinct line visible in the control area, then the test is invalid. Any line that appears outside of the control area or test area is an invalid test. An invalid test cannot be interpreted and must be repeated with a new device. Thus, viral load testing, it can either tell if a person has HIV or tell how much virus is present in the blood based on CDC 2021. However, Western blot, according to Stevens and Miller, it is the most often performed tool to confirm positive ELISA results, but it is no longer recommended. Next, treatment. Combination antiretroviral therapy, gold standard treatment for HIV infection. It is a combination of drugs from at least two antiretroviral drug groups. In the Philippines, the first line of treatment is a combination of tenofovir, lamivudine, and efavirenz, or a 3-in-1 tablet administered once daily for the rest of the patient's life. In prophylactic antiretroviral therapy, we have the pre-exposure prophylaxis and post-exposure prophylaxis. So here is our research synthesis. HIV is a retrovirus. It has an enzyme called the reverse transcriptase that convert viral RNA into DNA. It does not have the ability to correct its genetic material that give rise to mutations. Mode of transmission of HIV includes sexual contact, parenteral exposure, mother-to-child transmission, occupational exposure, blood donation and organ transplantation, and biting or deep open mouth kissing. Most uncommon transmission occur through pre-chewed food, sharing of contaminated razors or toothbrushes, manicure and pedicure, and contact of contaminated body fluids to mucous membrane. It is not true that sweat, tears, urine, feces, kissing, hugging, shaking hands, or sharing personal objects, food or water, masturbation, fingering, and hand jobs, and vector-borne transmission can transmit HIV. For prevention, individuals must use condoms, take antiretroviral drugs, and refrain from sharing needles. Blood transfusion must undergo HIV testing. Transplacental transmission should take HIV care, and wearing of PPE must be observed by healthcare practitioners. For the immunological standpoint, acute infection causes a sudden rise on the P24 antigen. A sudden decrease in anti-P24 is a great prognostic sign in HIV-1 infected patients. In AIDS stage, the CD4 and T cell count decreases and anti-HIV-1 antibody eventually decreases. In hematological standpoint, the most commonly observed cytopenia in HIV-1 infection is anemia. Next, hemostatic standpoint. HIV disrupts normal hemostasis. Thrombosis is 2 to 10 times more common in PL-HIV. In biochemical standpoint, biochemical changes in persons with HIV has decreased levels of high-density lipoprotein, increased levels of low-density lipoprotein, and total cholesterol. A combination of antiretroviral therapy is the gold standard of treatment in HIV infection. Now, let's proceed to the recommendations. Conduct further studies that focus on the significant effects of HIV to persons' physical, mental, and social wellness. Strengthen the collaboration and cooperation between and among local communities, people at risk, civil society organizations, and local and national governments through comprehensive information dissemination about HIV. And lastly, raise community awareness through education program, peer-to-peer discussion, and outreach activities in vulnerable sectors. HIV is a virus. It has no race, gender, or sexuality. The HIV should not spread together with the misconceptions, stigma, and discrimination. Be informed about the hidden truths of this chameleon-like monster. Be aware and join us to fight against the virus, not against the people living with it. Because no one is safe until everybody is safe. Once again, good afternoon.